Good evening, everybody. It is Dr. Michael Patmos, and it is Sunday evening, June the 7th, 2026. And I traveled today, and as I always do when I travel, I bring something to read on the airplane. And the only thing I read is the New England Journal of Medicine. If you're a doctor and you don't read the New England Journal of Medicine, shame on you. Ever since I was in medical school nearly 50 years ago, I've been reading the New England Journal of Medicine, and it is never fails to amaze me how great this journal is, the quality of the research, the quality of the editorials, the rigor that their editorial team puts into things. And you learn something in every issue. This is the most current issue. It's the June 4th, 2026 issue. And I found so many articles in here that were just very illuminating, things I didn't know. Well, there's one in particular that I want to talk about because, as good as this article is, it misses something very important. And so I want to talk a little bit about it. There is an editorial in the June 4th issue of the New England Journal of Medicine called Childhood Vaccine Hesitancy, and it's written by Dr. Sean O'Leary of the University of Colorado and Dr. Margie Danchin of the University of Melbourne in Australia. And it is a terrific article. It's basically a kind of a guideline piece, and it goes through a scenario where imagine you're a pediatrician or a family physician, and you're about to give a child vaccination, and the parent expresses vaccine hesitancy. And it goes into great detail about how to deal with vaccine hesitancy. And the article is great. It really reviews the literature on this topic. It has a fantastic table of all the proof that you can show to patients about how great vaccines are. It has another table entitled Structural Approach to Effective Communication or Effective Conversation with a Vaccine Hesitant Patient. And it gives you some of the vaccine hesitant patients' concerns and some potential examples of how you can respond. And then it has another table of interventions to stop the creation, spread, and belief in misinformation. And it goes through whole bunches of interventions. And the first one is system level stuff that's government and regulatory. And it mentions in their legislation to reduce the spread of harmful misinformation or social media through data access and transparency, and so on and so forth. And it gives a number of excellent recommendations about what we could do to combat misinformation. And it's all great. All the information is fantastic, but just like everyone else who writes about this topic, it misses what I think is the single most important part of the problem. The solution doesn't identify, target, and deal with the major cause of the problem. And I'm going to tell you what that major cause of the problem is right now. Everything that they recommend that doctors do to communicate politely and compassionately and understandably with these vaccine hesitant parents of children is all great. And it is all completely undone, all completely negated by 1 minute of a expert on TV or Fox News. The paper talks about the fact that 91% of patients who have vaccine hesitancy say they get their information from social media. I'm sure that's true, but that doesn't go far enough. It's not social media. It is someone on social media. It is a public figure in social media. It's not, I got it from Facebook. It's, I got it from somebody on Facebook. I got it from somebody on X. I got it from somebody on LinkedIn. It's the somebody that is not being addressed here. And I have spent the last 5 years talking about who those somebodies are. Because the reality is, let's say you're a family doctor or you're a neighborhood pediatrician, and you have this conversation with the parents of one of your child patients, and they respect you and they know that you're a doctor and you're practicing. Then they go home and put on TV. And on TV, they're presented with someone who is who is allegedly far above you, doctor. This person is an internationally known expert, a professor, an inventor of the vaccine, someone who has spoken before Congress, written papers, written articles, has an appointment as the director of the NIH or an acting director of the CDC, or is on the CDC advisory committee. These people are presented to the public as the ultimate experts. And so when these ultimate experts introduced this way to the public say things that are wrong, that are misinformation or disinformation, the public is going to say, well, wow, my doctor told me it's okay, but this doctor on TV, who's a real expert, said something utterly different. In 1 minute, all of the good work that your pediatricians and your family physicians and other physicians have done to try to follow the New England Journal guidelines is erased. Boom, negated in 1 minute by a fake expert on TV. Now, what do you mean, fake expert? Here's the scandal. Here's the untold story. The reality is, essentially, every one of the physicians that you identify with as being the leaders of the anti-vax movement, every one of them, and I know because I have vetted their resumes, virtually every one of them has got something in their resume of concern. I'm talking about resumes where there's things that are embellished, things that are exaggerated, sometimes things that are actually fabricated, positions that never existed, faculty appointments that never existed, and just tons of information on these resumes that if you try to verify, you can't independently verify a lot of the claims on these resumes. So the public doesn't know this. When I talk to patients and I talk to people about the qualifications of these anti-vax experts, the public doesn't know. The public thinks, for example, that Dr. Jay Bhattacharya, who is the director of CDC and the interim director of CDC and the director of the NIH, is a professor of medicine at Stanford, that he's a fully trained, highly qualified physician. They don't know what his qualifications actually are, but I do, because I've gone through his resume line by line and vetted everything. Here's his credentials. He does have an MD degree from Stanford, and that's it. He never did 1 day of postgraduate medical education. No internship, no residency, no fellowship, no board certification, no board eligibility, no MD license, no hospital medical staff membership, no hospital medical staff privileges, no clinical experience. He's never taken care of a patient. And does the public know this? No, they don't. They do know that he has an MD, he's a professor, but his PhD is in economics. He doesn't have a research background doing hardcore bench science research or clinical research, the kind of research that's done at the NIH. His research is public policy in healthcare economics. That's great, but it's the wrong credentials for his role. And it doesn't qualify him to speak as an expert on COVID or on vaccines. So when Dr. Bhattacharya gets on TV and he's introduced as a professor at Stanford and director of NIH and director of CDC and, a internationally, globally recognized expert, the public has no idea that he never even did an internship. For those of you who don't understand, the training of a physician, medical school is the beginning of that training. It's not the end. A fully trained physician goes to medical school and then does an internship and residency, And then if they're going to be a specialist, they then do a fellowship, and then they pass a test. That's a fully trained physician. A physician who graduated medical school and never did one day of internship is not a fully trained physician. So when these doctors are on TV, they're being introduced to the public, what they should say is, here's a doctor who is an economist, who has no postgraduate medical education, is not an infectious disease doctor, but he's going to tell you what he thinks about COVID and infectious diseases and vaccines. The reality is, someone with that little limited credentials is not qualified to opine as an expert about vaccines or infectious diseases. Let me say that again. Someone like Dr. Bhattacharya, who's never did an internship, is not qualified to opine as an expert on infectious diseases. I'm sorry. No internship, no residency, no fellowship. Not qualified. He's not the only one. There are others. Now, I've been saying this for 5 years. I've dug into the CVs and resumes of all of the anti-vax people, physicians and non-physicians, and I have found that almost all of them have questionable resumes. That's not surprising. There's about 50% of all resumes stretch the truth. Sometimes it's a little stretch, sometimes it's a big stretch. Outright fabrication on a CV is a really bad thing. Now, I've been saying this for 5 years, and for whatever reason, I can't get anybody to bite. I've talked to a number of folks about this. I've posted dozens of articles about this, and still, these folks are on TV, and they're still being presented as experts, and the public largely doesn't know that they're not true experts. They're unqualified. Finally, in March, somebody agreed with me. And who's that somebody? It was Judge Brian Murphy, federal court judge in Massachusetts, who presided over the case of the American Academy of Pediatrics, American Academy of Family Medicine, Infectious Disease Society of America, and the American College of Physicians, and other groups, all of whom sued Robert Kennedy and the Department of Health and Human Services over the guidelines that were issued by the CDC Advisory Committee on Immunization Practices. And that judge, did review the CVs and the resumes of the people on the ACIP and came to a stunning conclusion, basically corroborating everything I've said. The court concluded that the members of the ACIP were, quote unquote, distinctly unqualified. Quote unquote, distinctly unqualified. Furthermore, the court found that the vice chair of the ACIP was not only distinctly unqualified, but also, quote, lacks qualifications and experience to opine as an expert on vaccines. So, wait a second now. You're telling me that the experts handpicked by Robert Kennedy to sit on the most important committee advising the public, advising doctors about vaccines, are distinctly unqualified, lack qualifications and experience? Is that possible? Yes, that's exactly what I've been saying for 5 years. Finally, a court agreed with me. So, but still, that got headlines for, very briefly. The court also issued a stay against all CDC ACIP recommendations, but the damage has already been done. The public heard about the fact that the ACIP wanted to reduce the number of vaccines and not give neonatal hepatitis B vaccine and so forth. But they didn't hear the most important thing, which is the members of the CDC ACIP are, quote unquote, distinctly unqualified and lack qualifications and experience. This is the problem with the New England Journal article. It talks about all these other interventions, but it neglects the fact that we need to educate the public about who these experts are. Because I guarantee you, when the patients go home and they turn on the TV, they're hearing from one of these vaccine experts who they think is legitimate, who they think is really a world authority, and they're not. And in fact, their resumes are often very exaggerated. So even embellished, even fabricated. So I think that we are never going to get a handle on vaccine hesitancy and vaccine misinformation so long as we allow people with fake resumes, embellished, exaggerated resumes, resumes with fabricated resumes. You can't verify stuff. Allow them to get up there and have the podium, take the microphone, and speak to the public without being exposed. They have a right to free speech, but the public has a right to know their qualifications, what their qualifications are, and what they aren't. And that's not been done. No one, no one, oh, I know one person, no one has bothered to take the time to vet these resumes and present the information to the public so the public can see who these experts really are and whether or not they are truly experts. So I think these great articles and commentaries about how to deal with vaccine hesitancy, they all miss the point. A good doctor could do all the things recommended in the New England Journal article. Patient could go home in 1 minute. Somebody on Fox News can just negate everything you said. If we're going to deal with this misinformation problem, we've got to expose people whose resumes don't measure up. Thank you.